Good morning and welcome everyone. Thank you for joining us on this webinar, Quality First, Supporting a Transformation to Excellence. My name's Janet Littler and I'm a Quality Lead Auditor with CHKS, prior to which I worked for many more years than I care to recall in nursing, midwifery and in health visiting. CHKS, as you'll hear later, is a trusted provider of quality improvement and assurance services to the healthcare sector, with a mission to create better health outcomes, focusing on continuous quality improvement. We wanted to hold a webinar on this topic as we recognise healthcare services everywhere are currently facing significant challenges. We know from our clients' experiences that accreditation programmes provide helpful structures which help to support organisations in their implementation of current best practices. They empower staff, increase engagement and generate confidence in the quality of the services that they're providing. But before we go any further, let's deal with a few brief housekeeping points, which will also allow a little extra time for the last few to join us. In GoToWebinar, there's no option for attendees to have their webcams on. So whilst you can see me, or at least I hope you can, I'm not able to see you. So please don't hesitate to type any questions you have into the chat box, and time permitting, we'll answer these at the end of the programme. We want this to be comfortable, interesting and an enjoyable experience, so please message using chat if you think we're speaking too quickly, quietly, loudly, or perhaps if we're out of sync with the slide that you're viewing. To try and limit noise interference, other than the person presenting, everyone will automatically be on mute. We're recording the session, and for those who are interested, we'll provide a copy of the recording along with the relevant slides for you to review or share with your colleagues. Let me do a quick introduction first to those presenting today. In addition from myself, we'll also hear from Alan Henderson. Alan's a Business Development Manager across the CHKS, including accreditation services, benchmarking and clinical coding. We'll also hear from the Accreditation Director at CHKS, Moira Amos. But let's begin by looking at the agenda. During the webinar, we want to set the programme against the context of the Irish healthcare market. Can we have the next slide, please? We want to consider the nature and benefits of accreditation, discuss in more detail what CHKS is, how our programmes work, and their benefits, including the VHI framework application. We'll talk about the benefits to organisations and to patients of working towards accreditation. And we want to give you the opportunity to hear from one of our clients who has successfully worked with the programme, after which time, hopefully there'll be time for your questions, of which there'll be many. We recognise you're all busy and our time is limited. So without further delay, I'll hand you over to Alan, who'll explain our place in the Irish healthcare market and how CHKS can support the landscape over there. Thanks very much. Over to you, Alan.
Thank you, Janet. So who are CHKS and what can we do to help in supporting the Irish healthcare organisations both improve on quality assurance and to be a VHI preferred supplier? So founded in the King's Fund, a think tank for the NHS, and has been providing assurance and healthcare intelligence solutions to healthcare service providers throughout the world for more than 30 years. CHKS was the first hospital benchmarking organisation providing comparative data and analysis, which delivered research and consultancy to support clinical accountability, service planning, evaluation, and groundbreaking learning for the health service in the late 1980s. We've worked with healthcare organisations in over 20 countries, including more than 100 large acute hospitals in the UK and over 150 clients throughout Europe, with a mixture of independent, private and public healthcare providers. CHKS has developed and improved its quality through certification and accreditation achievements of its own, and has developed comprehensive software to support its services. Assurance and accreditation provides the standards and framework which best describe best practice. Application of the accreditation standards improves outcomes, which can be measured and monitored through the benchmarking dashboard of indicators. So our other services, including benchmarking and clinical coding service, including remote and AI coding, training and audit services. Together, the services support the delivery of safe, efficient, and quality practice in health and care. CHKS currently provide assurance and accreditation to over 100 clients throughout Europe. CHKS are one of only 2 accreditation providers accepted by VHI for their new framework applicants, with CHKS taking the industry standard ISO 9001 and combining it with its own accreditation program, providing a dual award specifically designed within a healthcare setting. While CHKS provide accreditation and assurance services globally, including to the NHS in England and Wales, our largest market is in Ireland and Northern Ireland, and private healthcare providers specifically, which have the largest market share, representing over 40% of our client base. This is particularly pertinent in the case of VHI as an insurance provider for its private healthcare patients. Whilst healthcare organisations in Ireland can independently accept private healthcare patients, with procedures claimed back as part of their insurance cover, many organisations, however, are not on an approved preferred supplier list. VHI have almost a 50% market share in Ireland and are by far the biggest healthcare insurer. VHI require potential applicants to have started an accreditation program with a signed contract showing your intention and commitment to quality assurance, making a start on a self-assessment or gap analysis, and to have a pre-survey visit booked before being accepted on their framework. This process generally can take up to 6 months to complete, with VHI's framework taking applications in April of each year. VHI require this commitment and assurance from an organisation to be on their framework. It also enables organisations to enhance brand exposure, become more reputable for their patients, and thus increase revenue. For an external assessment, our programme will provide you with an internationally recognised certification and award in which to assure your customers, your prospective clientele, and your insurance provider alike. I'll now hand over to Moira.
Next slide, please. Thank you, Alan. And the next slide, please. Thank you, Alan. So CHKS Assurance Accreditation Programme is the only UK-based service which offers an accreditation programme covering both clinical and non-clinical services. As you will all appreciate, for clinical services to operate effectively, they do need the supporting services to be aligned. As Alan mentioned, CHKS are the only UK provider of a dual award programme of both certification and accreditation, specifically designed within the healthcare setting. CHKS, as you can tell from our history, have always believed in quality and sought and achieved qualifications to ensure we deliver to the highest standards. We are accredited by the United Kingdom Accreditation Service, UKAS, to award ISO 9001 certification, and also by the international accrediting body ISQA, External Examination Association, for the way that we run our organisation and our programme, and separately for the way that we develop our standards in line with best practice principles. As you can see on the slide, the definition of healthcare accreditation includes self-assessment, followed by a peer review assessment against established standards. And that's with a view to accurately assess the level of performance and to implement ways to continually improve. So the CHKS accreditation programme provides participating organisations with a quality assurance tool, which organisations can confirm the quality of their systems, processes and service delivery, and where gaps are identified, guide them to resolution. The standards framework is user-friendly and engenders a spirit of collaboration and engagement, which is often carried on beyond that initial programme. So while the general standards cover areas of governance, leadership, risk, safety, quality and patient experience, the specialist standards reflect more specific service areas. So by following the programme, healthcare managers and clinicians are empowered and protected by good governance and feel confidence in their delivery, ensuring safe practice. So on the accreditation programme, we've got the slide on the screen already. This slide provides an overview of the accreditation programme cycle. Clients are initially provided with a set of standards, which I just described, which fit the scope for their service. So to start, clients are first advised to take a baseline assessment, which then allows them to form a gap analysis. The next step is to plan for the independent survey or peer review. Experienced clinicians and managers act as our independent assessors, and they come on site as a team to review the self-assessment of the organisation and their compliance with the agreed standards. We tend to plan the survey for about 12 to 18 months from the start of the contract. Occasionally, clients will plan a survey earlier than 12 months, but only usually by 1 or 2 months, and certainly not before 6 months, primarily for logistical reasons in planning the survey. We also do not look to delay a survey beyond 18 months as the contract is organised for the deliverables to be delivered within the timescale of the contract. We find that on the whole, clients are well prepared and ready for survey on this basis, having been encouraged and guided by the quality lead auditor to meet the milestones along the journey. So this peer review assessment can take between 2 and 5 days, depending on the size of the organisation or the service. It has a formal structure, it's timetabled and agreed well in advance, but there's no unannounced visits. So the time then between the end of the survey and the award of accreditation, a report is compiled, which goes through a rigorous and impartial review process. And if there are no outstanding criteria if there are outstanding criteria at the end of the survey, there will be then an action plan to support closing those off. Following that, the report goes to the panel and an award is given for 3 years from the date of the survey. As you can see on the diagram, as the cycle goes round, within the next 3 years, there are 2 surveillance visits at the anniversary of the survey. And then the cycle continues round again. And many of our clients, as a result of that, see us as their quality improvement partner. The standards are updated regularly and so will be refreshed in time for the next survey, so providing that opportunity to continually improve. Critically, the standards are mapped to the HICWA standards, so we prepare organisations in Ireland completely for any regulatory inspection or visit. And those staff who have been familiar with preparing for our programme are then, they have the evidence available and they're familiar with those professional conversations which are needed when a regulator. The next slide shows some key benefits. So the overall goal, of course, is improved outcomes and experience for clients and patients. This is central to our purpose, and our staff and surveyors are passionate about this. However, there are some specific benefits which support the organisation, which I'm going to allude to now. So firstly, an accreditation programme provides a best practice framework through which to develop policy and practice for the organisation. Our standards have been created through a long and intensive process with the help of industry experts. And these are reviewed, as I said, and revised regularly to ensure they remain abreast of the latest developments in practice. So the framework then, as a result of following that framework, it leads to standardisation of working practices. Accreditation requires organisations to examine their processes in every department. And this analysis and review enhances the quality of care by decreasing variations in the delivery of the service. It integrates the corporate and the clinical governance, and as a result ensures efficiency and best outcomes for patients. So those standards support the delivery of consistent, standardised, excellent care throughout the facility. So it's like a full governance check, and it reduces, as a result, the opportunities for errors to occur, which of course can lead to litigation. So having this comprehensive framework in place means you can demonstrate you've assessed and mitigated the risks. The other aspect that the programme enables is engagement with your team and your staff. The programme provides a project and a purpose for change for the team. It fosters that team working and staff engagement. And a motivated and well-trained staff is, of course, pivotal to the success of any healthcare facility. And that's from like reception through to the clinical staff. Everyone has standards which they can look to and work to and feel part of the programme. And by fostering that engagement and team development, it encourages those continual improvements in the way things are done. Another benefit is gaining international recognition, which can obviously offer competitive advantage. The award is recognised international because of our ISQA accreditation, and so shows an outward-looking organisation which would support any ambition within an organisation to deliver medical tourism. The award of accreditation shows that you take quality seriously, giving you a potential advantage again on your competition, and potential patients and partners are more likely to choose an accredited healthcare facility over one which is not accredited. And of course, staff and the providers themselves can feel proud of that award and use it as evidence, as I said, within regulatory inspections. Alan touched earlier on the fact that this accreditation is required to become a VHI approved supplier, which enables you to provide to a wider group of patients and thus would increase your revenue. I mentioned the independent and impartial review. So this group of peer reviewers who are impartial will see issues that you have chosen not to see for some time. We all do it in our own organisations. So while internal audit is really important, this external peer review brings that fresh pair of eyes and solutions with an impartial commentary. So finally, it provides effective preparation for any statutory or regulatory compliance visits. Navigating the complex landscape of healthcare regulations is a substantial challenge for healthcare facilities, and being accredited against best practice standards provides organisations with the assurance that they are covering and complying with the regulators and usually surpassing their expectations. Next slide, please. So this slide is just showing some of our clients in Ireland. As Alan mentioned, we have 40% of our client base is in Ireland, and we enjoy working with all our clients here. We also work in Portugal and in Cyprus, who recognise the quality of leadership in healthcare in the UK and choose our programme over any in-country competitors. We work, as you can see, with both the private sector and across charity sectors, with hospices and addiction treatment centres in Ireland and in the UK. So the final important part of our seminar is a view from one of our clients in Ireland and who has shared their views on our programme. And I'm going to hand you back to Janet, who is going to talk on their behalf about their experience and their outcomes. Thank you.
Thanks, Moira. Next slide, please. Oh, that's it, sorry. Maeve Mullaney is the CEO at the Rutland Centre, an organisation that's achieved accreditation and ISO certification through the CHKS programme over a number of years. Unfortunately, Maeve can't be with us today due to other commitments, but we had an interview with her and she told us a number of things that I want to share with you. Maeve told us that in the beginning, there was some difficulty generating enthusiasm as the staff considered the programme would only add to their workload. However, as they moved through the programme, things changed, and she now reports that they have an internal focus through the programme. They have an internal focus on quality, which is embedded within the organisation. She said that staff find the programme enjoyable even, as it validates the work that they do, such that they, rather than fearing external inspections, they embrace them as an opportunity to show what they can do. She also told us that the programme pushed them to always do better. Maeve says the programme has engaged staff, helping them to move away from trying to make practice fit policy, such that they're now able to secure staff engagement with policy and through that improve compliance. She described to us how working with the CHKS programme supported development of their people processes, from recruitment and onboarding to development of supportive processes which have led to improved retention, provision of internal development opportunities, and better engagement with succession planning. In short, she told us the organisation had to shift their thinking, embrace the processes, see the opportunities to do better, and to actively seek development. And I think those comments sum up in a really succinct way the benefits of working with CHKS. So thank you to Maeve for that detail. We now have a video to share with you. So over to Alan.
Looking to transform your healthcare service? CHKS has been supporting health and care organisations for over 30 years. With a passion for improving patient care around the world, CHKS is your dedicated partner in elevating standards to improving organisational practices in core areas of quality, safety and efficiency. With effortless management, our accreditation programs are backed by an online resource that allows you to clearly see the improvements to your organisation in real time through self-assessment to external assessment. Essential core principles underpin our library of standards, designed to guide you for every step of the way. One of many benefits of working with CHKS is that our accreditation programs support healthcare providers to deliver the best version of care through evidence-based best practice standards, providing a joint award of accreditation and certification. Join the ranks of healthcare organisations that have completed the accreditation journey and have not only elevated their patient safety standards, but have empowered and developed staff, creating a unified workforce with a passion for quality improvement. CHKS have established a framework for integrated governance, and we are working to drive the sustainability agenda. Our accreditation is recognised by the national regulator as a robust and high-quality accreditation scheme, working hand in hand with you to develop and improve your services. Contact us today and let's build a future where improving quality of care is the everyday.
Thank you, Janet. So we do have a few more minutes available, so I'd like to introduce you to my colleague Prithpal, who will quickly just go through some of the questions that have already been posted. Please do remember, if you would like to post any question whatsoever, please do so now in the chat.
Thank you, Alan. So we've had a few questions submitted. The first is, what is the biggest obstacle you have helped a client overcome during their journey to achieving accreditation? Janet?
Thank you. That's an interesting question, and I guess one to which there's no real simple answer, partly because our client organisations are so diverse. But perhaps from my own experience, I can answer it, and I'd say that capacity is one of the obstacles that is raised in the early stages of the programme. There's so much work to be done. Everyone's working hard, resources are scarce. But I think sometimes when we are so busy in our everyday work, we can sometimes lose sight of the wood amongst the trees. And we don't have much time to think about why or how we're doing things. Working towards accreditation, whilst, yeah, it does require some investment, but it also requires reviews of the systems and processes that are in place, which and doing that can result in changed activity, which sometimes releases time, which can be allocated to that additional work. Let me give you an example. We noted whilst working with clients in primary care that the team were using an IPC audit tool that was designed for hospitals. It was 16 pages long and was taking significant time to complete. But it didn't really reflect primary care service provision, and it didn't really give them anything in the outcome of the audit that they could work with. But when the QLA was working with these clients to look at this criterion, the team came to better understand the requirement, and they were able to develop a programme which better reflected the risk areas in their workplace. And so whilst it conferred an increased benefit and some relevant learning, it also saved them significant time because it was so much better focused. And that time that they saved was then reinvested in other work towards accreditation. So I think, I think it was confirmed by Maeve that this idea of investment and time is initially something that is of concern, but it's something that reaps benefit. I hope that sort of answers the question there. Thank you.
Thank you, Janet. The next question that we've had come through is, if we are interested in considering an accreditation program, how would you support us with gain organisation buy-in? Maura?
Okay, thanks, Pritpal. Yeah, it's a good question, and we do get asked if we can help to support, especially sometimes if it's a department or a service within a hospital and they need to seek a higher approval. So we're always happy to help build a business case, for example. We've got case studies demonstrating benefits, and we can support looking at the cost savings, which there often are. And direct improvements in CQC ratings are always a good argument to present to senior managers, and certainly happy to come and do a presentation to a wider group, because often it's, you need to get the ear of those senior people to make a convincing argument. So yes, more than happy to help with that.
Thank you, Maura. Another question we've had come through is, if we are prepared for a survey before the 12-month period, or possibly if we think we are better prepared than we are, is there any flexibility to bring the survey date forward, for example, to 9 months, or indeed push it out beyond the 12 months?
I'll take that one if you like. So yes, there is, and in fact, within the first few months of a contract, discussions would be, how are you, where are you on the sort of quality journey? Has there been any achievement of quality certificates in the past? You might have some things in place. So that first few months, 2 or 3 months, is very much about assessing where you are. As I said, a gap analysis that allows you to see what needs to happen prior to the survey for the best outcome. And for some organisations, they may have done an ISO before, but this is their new sort of step into a wider patient-orientated accreditation program. But they may have a sort of decent quality management system in place, and therefore 9 months, 10 months, it could be that you set a date around that. It's completely individual to the organisation. So a conversation between the quality lead auditor and the organisation, such that fits everybody's timetables, is what takes place, and that discerns when it happens. Many clients, they think, yeah, we're going to go for that 12 months. I mean, we all need a goal, don't we? All need we can't just keep putting it off. So they go for that sort of 12 months initial plan, but things happen, organisations are complicated, and so they may put it off and find they need another couple of months for whatever reason. So certainly 14 months is also acceptable. I think it's when it runs beyond 18 months, as I said in my description of the programme, it starts running into how much of the contract is left, if you like. So, we have a set number of deliverables that have to be delivered within that. So, but I think that, from my experience, gives plenty of scope for people to work to. Thanks. Hope that's okay.
Thank you, Maura. And we've got one last question, which is, what is the next step should we wish to find out more?
Okay, great question. So certainly what we'd normally do when someone expressed interest in going forward with our programme is we send them a client profile form, which allows them to describe the type of service they are. Sometimes it's multiple services, sometimes a hospital with full services, sometimes very discrete, but we just need to really understand the scope of the service. So the completion of that form sent back to us then allows us to generate survey requirements, so what standards are required and the size of the survey. 2 surveyors for 2 days, or 2 surveyors for 5 days, 5 surveyors for 5 days, any number of combinations. So we then compile a proposal based on the size of the survey and the other aspects around that, and send that back to you with full details of what that programme looks like. And then we have a conversation. We are, of course, as I mentioned earlier, more than happy to come and speak to a wider group, do a wider presentation. So there is that important leadership buy-in is really important when you're introducing a program like this, and we want it to be successful. So we're more than happy to present as well to enable that greater understanding across the whole organisation. Hope that helps.
Thank you, Maura. And that's all the questions for today.
Thanks, Prithpal.
Thank you, Prithpal. And thank you to everyone for kindly taking the time to join our webinar today. I hope you found it interesting and now have a clear understanding of the beneficial features of our accreditation program. If you'd like to have a brief demo or overview of the accreditation online software, please do feel free to contact us. We're always here and happy to help provide any support in terms of a demo, etc. Alternatively, if you'd like to explore the next steps, please feel free to contact me directly. If you request, I can then provide you with a client profile form to complete, as Moira has mentioned. This will offer us a much better indication of the size and scope and your accreditation requirements of your organisation. We can thereafter provide a proposal based upon those findings presented within your client profile form. Once again, if you have any further questions whatsoever that you'd like to have a chat about or the topics discussed today, then please feel free to reach out. I'm very happy to give you a few minutes of your day back. Thank you for your time and enjoy the rest of your day.
Thank you.